Have you ever looked at an insurance plan and wondered, what exactly is a deductible? Why do I still have to pay when I already have insurance? And what's the difference between a copay and coinsurance? If you're a medical biller, eligibility specialist, or even a patient trying to understand your medical bills, this video is for you. Today, I'm going to break down deductible, copay, and coinsurance in the simplest way possible using real healthcare examples. From my 9 years of experience working in customer service, claims, and accounts receivable, let's get started. Hi everyone, welcome back to the channel. My name is Marvin and I've been working in healthcare for the past 9 years. Throughout my career, I've helped patients understand their insurance benefits, verified eligibility, and resolved billing issues. One of the most common questions I hear is, what do deductible, copay, and coinsurance actually mean? By the end of this video, you'll understand what each term means and how they affect patient responsibility and claims processing. Let's start with the deductible. What is a deductible? A deductible is the amount a patient must pay out of pocket before their insurance starts sharing the cost. Think of it as your entry fee. Let's say your annual deductible is $1,000. You receive a medical service costing $500. Since you haven't met your deductible yet, you'll pay the entire $500. Your deductible balance now becomes $500 remaining. If you later receive another service costing $600, you'll pay the remaining $500 deductible. After that, insurance may begin sharing costs according to your plan benefits. Medical biller tip: when verifying benefits, always check individual versus family deductibles and the amount met. Many patients are surprised by their bills because they don't realize their deductible hasn't been met yet. Now let's talk about copays. What is a copay? A copay is a fixed amount the patient pays for a specific healthcare service. Unlike a deductible, the amount doesn't change. A plan may have a $25 primary care visit copay, a $50 specialist copay, or a $15 prescription copay. If your doctor visit costs $200 but your copay is $25, you only pay $25. Insurance handles the rest. Patients usually like copays because they know exactly what they'll owe. No complicated calculations, just a fixed amount. Medical biller tip: when checking eligibility, verify PCP, specialist urgent care, and ER copay separately. Never assume all visits have the same copay. The difference can be significant for the patient. Now let's discuss the concept that confuses people the most: coinsurance. What is coinsurance? Coinsurance is the percentage of healthcare costs that the patient pays after meeting the deductible. It's a shared cost. Let's say the deductible is met and coinsurance is 20%. Insurance pays 80% and the patient pays the other 20%. For a $1,000 procedure, the patient pays $200. In this case, insurance pays the remaining $800. Easy way to remember: copay is a fixed dollar amount while coinsurance is a percentage. You're already ahead if you remember this. Medical biller tip: always verify in-network versus out-of-network coinsurance. These percentages can be very different. Let's compare all three. Deductible is what you pay before insurance kicks in. Copay is a fixed fee for services. Coinsurance is a shared percentage. Let's walk through a real-world scenario. Patient has a $1,000 deductible, 20% coinsurance, and $50 specialist copay. The patient has met $800 of their deductible and receives a $500 service from a specialist. Let's calculate. Step 1, the patient pays the $50 specialist copay. Step 2, the next $200 goes toward the remaining deductible. Step 3, coinsurance applies to the remaining $300 balance. 20% of $300 is $60. The total patient responsibility is $310. Here are some lessons I've learned over my 9 years in healthcare. Tip number 1, always verify benefits directly with the payer. Never rely solely on old notes. Tip number 2, document everything. Reference numbers and representative names can save hours of rework. Recap: deductible is pay first, copay is fixed fee, and coinsurance is shared percentage. Subscribe for more training. What insurance concept confused you most? Leave a comment below. Thank you for watching, and I'll see you in the next video. Happy billing!